as a patient, how can I really undertake it in? But it comes down to who is taking care of you. That is why we will discuss a lot on the family. We'll discuss a lot on who is, who isn't, who is in, who is out, who is just there. We'll get to know how am I going to move forward. So it's all about you, the patient. It's not about what your family says, what your mom says, what your dad says, your uncle, and everybody. It's their beliefs, but what about you? What do you really want? And getting to how do I cope with it? Of course, there's the loss and grief, which we're going to go through later, and I'm not going to really expand on it. Health is a loss, and of course, this is the 7 stages of grief by Elizabeth Ross, which we are going to go through, and of course, the way of breaking information also is very important. You can't, it's said that a cat can't land on all their feet, so you cannot just come up and break information just like that. You also need to be clever about it and know how am I going to do this without causing any damages or harm. And so getting to talk about it, there's the aspect of counseling, there's the medical aspect, which is also really important, and of course it's about you going home, let it sink in that yes, this is the reality, and yes, this is where I am in the here and now. So how am I going to move forward without looking backward? That's a question we are going to ask ourselves for today. How are we going to do things moving forward? How am I still going to go to work? How am I going to, and also to view the world, my friends, and the perception of the community, and how am I going to survive? So getting to ask yourself this question, how am I going to really cope? One, just take time, accept to get to know how am I going to start treatment, get to ask the oncologist as many questions as you possibly can to get clearer information on how these treatments are going on. If it's surgery, what are they going to do? They can't just operate on you, and you don't know what you are going to be operated on, what organs are they going to remove, or what they are going to do to you. It's important to find out. Number 3, of course, get to know what to eat, what not to eat, what to do, what not to do. Get to talk to a counselor. Get to check inside yourself and ask yourself, what is there for me moving forward. And of course, you have to close your ears and make sure that there is no negativity coming through here and leaving through here, or coming through here and sticking here in the middle. By this I mean the community doesn't have to know a lot of things. Make sure that the community doesn't really have to criticize you, because very many people will come and do that. Not very many people will love you. And of course, for the caregivers, they'll say that this person died because of this person, and yet you, the caregiver, are there to offer this support. You came to show your solidarity to the patient and show that you are going to help him or her go through it together and find a better way out of it. And of course, it's also about helping the family of this patient to accept that this is the reality, and how am I going to move forward as a family. How do I go and talk to the doctor and say this is what I want, and this and this and that. As a patient, it's important to stand your ground, stand your position. It's your cancer, your treatment and your way to solve your issues, and your second chance to live life to the fullest. Even though it doesn't, even though you feel what I'm saying doesn't make sense to you, all you need to do is subscribe down there, and we will get to talk more